Hello, hi, my name is Stephanie. I'm a physician assistant student. I just want to ask for your consent to perform physical on you, if that's okay?
Yes.
Okay, and what is your name?
Cynthia?
Cynthia. Okay, Miss Cynthia. So I'm just going to ask you a few questions. Can you let me know where we are right now?
Yes. The UTRGB library.
Library. And do you know what day of the week it is?
Yes, it is Monday.
Do you know what city we are in?
Yes, we're in Edinburgh.
Okay, thank you, ma'am. So Cynthia's affect, mood, and manner is normal. Her parents' state of health is also normal. No signs of distress whatsoever. Her level of consciousness is normal. Body habitus and posture is normal. Dress, grooming, and hygiene is also normal. And she also has a normal speech. Okay, so now I'm just gonna take your pulse book. I can just see your wrist like this. Thank you. Okay, thank you. Now I'm just gonna also, if you can just put your hand across. There we go. I'm just gonna count your respiratory. You can just breathe in and breathe out for me. Thank you, ma'am. So the patient's radial pulse is equal bilaterally, and her rate, rhythm, and pattern is normal. It is also regular. Thank you. I'm going to take your blood pressure now, okay? Where would you like me to place the blood pressure cuff on you? This one? Okay. Thank you. This around. Okay. So have you rest. Thank you. Turn this around. So 120, I'm going to add 30 to that, okay? So we'll start at 150. Thank you. So 180 over 78. Yeah, blood pressure is normal. Thank you. Okay. So now I'm just going to look at your skin for me. Thank you. Have you noticed any abnormal lesions or moles or anything like that? Okay. So I'm just going to look at your moisture of your skin. Good. If you can just open your mouth for me. Okay. Moisture in your mouth is good also. Thank you. Just going to check for turgor and mobility. Thank you. Okay. And also color of skin and nails is also normal. I'm going to look at your nails for the capillary refill. Thank you. So that is okay. Okay. Thank you, ma'am. Okay. So now I'm just going to inspect your head, just make sure everything's okay. Have you noticed any abnormal bumps or anything like that on your head? Okay. So I'm assessing the cranium. And I'm just going to look at your hair. What about any hair loss or anything like that? Okay, thank you, ma'am. Okay, and assessing also the scalp. Okay. Thank face is normal, no abnormalities whatsoever. If you can just open your mouth for me and then close it. Thank you. Okay, so now I'm just gonna check your visual acuity. Okay. And if you can just tell me with both eyes, what is the smallest line you can read?
563297.
Okay, if you can cover your right eye for me. And if you can read the smallest line you can see from left to right.
563297.
Great, that's 2030. If you can cover the opposite eye for me, please, and read the smallest line.
792365.
Okay, great. Thank you, ma'am. Okay, so now I'm just going to do lights. Here. Okay, your eyelashes, your eyes. If you can open and close your eyes for me. Thank you. Okay, and I'm just going to have you take off your glasses for me real quick. Just going to touch your eyes, okay? Okay. Lacrimal gland, duct. Great. Thank you. Check the side. Great. Thank you, ma'am. Okay, so I'm just going to inspect the conjunctiva. Thank you. And the sclera and the cornea. Thank you, ma'am. Okay. And the anterior chamber I already checked. Okay. Now I'm just gonna put my hand in the middle. You can just look straight for me. Thank you. Thank you very much. Okay. And if you can just let me know whenever you see my fingers, okay? So I'm gonna place them around your head. Just let me know whenever you see them, okay? Okay, thank you, ma'am. Okay, so now I'm just gonna look in your eye, okay? Just to look at your eye features, make sure everything is normal. Great, thank you very much, ma'am. Let's have a look one more time. Identify the bed reflex and identify the fundus structure. Okay, thank you, ma'am. Okay, so now I'm just going to look at your ears. So the meatus, the auricle, and the mastoid process on both sides. Thank you. Okay, and then I'm just going to look inside your ear now, okay? Thank you. Thank you. No ear pain or anything like that? Thank you. So I identified the external auditory canal and the tympanic membrane. So now I'm just going to perform the Weber test and the Rene test, okay? So I'm going to make a sign with this. If you can let me know if you can hear this bilaterally equal. So if you can hear it equally on both sides. Now I'm going to place it behind your ear and then in front of your ear. If you can just let me know if you can hear it. And then also when I place it in front of your ear, if you can let me know when you can stop hearing it. Okay. I'm going to do the same thing on the opposite ear, okay? Okay, thank you, ma'am. Okay, so now I'm just going to look at your nose just to make sure everything's okay. Okay. And I'm going to palpate it. Thank you. And I'm going to my light quick. So against the eye. Thank you. Okay. percuss the sinuses, the frontal sinus. Any pain? Yes, pain? Okay. And I'm just going to look at your nasal mucosa. If you can put your head back on. Thank you. Okay, so check the septum and the turbinates. And if you can cover one nostril for me, please. Okay, if you can breathe in for me. If you can cover the opposite nostril and breathe in for me. Great, thank you very much, Raj. Okay, so now I'm just going to look at your lips and make sure everything's okay. If you can open your mouth for me one more time. Thank you. You can move your tongue from left and then to the right side. Okay, thank you, ma'am. So I looked at the lips, the mucosa, the teeth and gums, hard, soft palate, the mouth. Also, do you feel if you can say "ah" for me one more time? Thank you, ma'am. And also looked at the tonsils and the posterior pharynx, and assessed the glossopharyngeal nerve, which you said "ah." And if you can open your mouth for me one more time. And I did the gag reflex. Thank you. Okay, so now I'm just going to look at your neck real quick just to make sure the trachea is symmetrical. Thank you, ma'am. And then also I'm just going to go behind and thyroid. Thank you, ma'am. Now I'm just going to check your lymph nodes, okay? So I'm going to check the preocular, the postocular, the occipital, the tonsillar, the submandibular, the submental here, the superficial cervical, yes, that's in the neck, and the posterior cervical, that's in the neck here, and the deep cervical, and the supraclavicular. If you can just stroke for me. Great. Thank you, ma'am. Okay. So now I'm just going to move on to your lung examination, okay? Thank you. So, okay, so I'm just going to, if you can just breathe in and breathe out for me. Thank you. Patient has no use of accessory muscles. She's breathing normally. Looking at her back. No scoliosis or kyphosis whatsoever. Okay, so I'm just going to palpate. Make sure that there's no, I'm going to palpate the clavicle, the sternum, and then the jugular notch, the sternal angle here. Okay. And the xiphoid process. The vertebra prominence here, thank you, and the inferior angle of the scapula here, rib 12 here, and thoracic vertebra 12, just be here. Thank you, ma'am. Okay. So I'm just gonna have you breathe in and breathe out for me. You can just breathe in for me, and then breathe out for me. Thank you, ma'am. Okay, so now I'm going to do the tactile affirmatives, which was, you can say 99 for me. 99. 99. 99. Thank you. Just do it on the back also. You see 99. 99. 99. 99. Thank you, ma'am. So now I'm just going to percuss, and on the front of your chest and on the back, okay? I'm going to do your back, okay? Okay, so now I'm going to auscultate, so I'm going to do the same thing. Thank you. Thank you. Thank you. I'm going to do the same thing on the back, okay? Just breathe in. Thank you, ma'am. Okay, so now I'm just going to have you lay on your back. I'm going to look at your heart. Let me just... I'm sorry. Okay. Okay, so now I'm just going to inspect your neck. Okay, thank you. And I'm going to check your cardiac pulse. Just breathe in and breathe out. Thank you, ma'am. Okay, and now I'm just going to check your jugular veins, okay? You can just breathe in and breathe out for me. Thank you, ma'am. Okay, and so now I'm going to inspect the PMI. If you can just turn to your side, please. Sorry. It's part of, huh? Just breathe in, breathe out. Thank you. Sorry, you can lay on your back again. Okay. So now I'm going to palpate the PMI. Just around here. Okay. And okay. And now I'm going to palpate also the now I'm going to auscultate carotid. Thank you. Just breathe in, breathe out. Thank you. Okay, and now I'm going to auscultate also other areas. You just breathe in, breathe out from. Breathe in, breathe out from. You can breathe in, breathe out from. Thank you. Okay. So now I'm going to, thank you, ma'am. So now I'm going to inspect your abdomen area, okay? I'm actually going to have you lay up for me. I'm sorry. And I'm just going to, just follow with me. Thank you. Just breathe in and breathe out for me. Thank you, ma'am. Okay. So now I'm going to auscultate, I'm going to do an abdominal exam, okay? So, would you like a drape or anything? Yeah. Okay, thank you, ma'am. Okay, so before I auscultate on your skin, I'm going to have you actually lay down for me real quick on the camera, okay? Thank you. I'm just going to expose this area. Thank you. Okay, so I'm just going to expose this area. Okay, so I'm going to percuss. I'm going to auscultate on the forehead or your stomach, okay? Okay, thank you. Okay, and I'm also going to auscultate the renal arteries. You can breathe in and out. And then also the femoral arteries, right here. Okay. And I'm going to palpate the femoral nodes. Just breathe in, breathe out. Okay, thank you. And I'm just going to percuss all 4 quadrants. Okay, and I'm going to lightly palpate them. Okay, and I'm going to deep palpate them now. Okay, if you can let me know if you have any pain when I do this. Okay, any tenderness whatsoever? No? Okay, so now I'm going to percuss and palpate the liver. So if you can just breathe in for me. So percussing for the liver. Okay, and determine where the liver is. So I'm going to palpate. If you can breathe in for me one more time. Okay, thank you. So now I'm going to percuss for the spleen. You can breathe in for me. So percussing for the spleen. Thank you. And now I'm going to, I'm palpating the spleen. Now I'm going to palpate the kidneys. Any pain? Thank you. And I'm going to percuss over the costovertebral angle. I'm just going to have you on your back. You put your chin down. Thank you. Okay. Thank you, ma'am. Okay. Thank you very much, ma'am. So now I'm just going to inspect your upper extremities. I'm going to move this out of the way, okay? Okay, so I'm just going to inspect your hands real quick. Okay, inspecting your digits and your wrists. Any pain here or anything like that? Elbows and shoulders. Okay, good. So the epitrophial lymph nodes also, so I'm going to feel all the way up. The epitrophial. Thank you. And then now I'm going to feel the axillary lymph nodes. Thank you. Okay, so if you can just, I'm going to determine the range of motion of your neck. If you can just flex your neck for me. Thank you. You can extend it back. Thank you, ma'am. Okay, and if you can bend it to the side and then to the other side. Okay. Thank you, ma'am. Any pain here or anything like that? Okay, so I'm going to have you do the same thing, but I'm going to put my hand on you, so it's going to be 4. So if you can put your forward. Okay, put it back. Thank you. To the side. Okay, to the other side. Okay, thank you very much, ma'am. Okay, so now I'm going to determine the range of motion of your shoulders. So I'm going to ask you to stand up for me real quick, okay? Thank you. If you can put your shoulders all the way up. Thank you. And then all the way down. If you can put your shoulders like this. And away from your body, you can go like this. Yes. Thank you. And I'm going to have you also put them across. This. Thank you. And then if you go in like this, like a football, and then go down. Great, thank you. So I'm going to do the same thing, but if you can just, I'm actually going to do it for you, actually, sorry. So it's going to be shoulder flexion. So, here, and back, here, sorry about that, and then cross, and then I'm going to have you go like this, and like this. Great, thank you. And also, good, thank you, ma'am. Okay, so now I'm going to determine the range of motion of your elbows. So if you can just keep the elbows on your side, and then if you can flex them, here, and then extend them. If you can put your wrists like this, and then like this. Great, thank you. Okay, so now I'm going to determine your muscle strength. So I'm going to do that. If you can just push against me. So if you can go up, thank you. Go down. Okay, and then go up. Okay, thank you. Okay, so now I'm just going to determine the active range of motion of your wrists. So if you can flex your wrists up, flex them down. You can go like this. Great, thank you. And if you can now, you can do it against my strength, please. And go down. Thank you. And then to the side. And then the other side. Great. Thank you. Okay. So now I'm going to have you flex your fingers into a fist. Thank you. And then extend them. And then spread them. Okay. So now I'm going to have you squeeze my fingers as hard as you can. Thank you. This one. Thank you. And if you can just spread your fingers against my fingers. Thank you. Okay, so now I'm going to inspect your hips and knees. So if you can actually sit down for me one more time. Okay, so I'm going to palpate your hips. Right here. Thank you. I'm going to palpate your knees. Okay, and I'm going to palpate both of your ankles. Any pain here or anything like that?
No.
And then your toes. Okay, now I'm going to look for your popliteal pulse. So it's going to be on your knee right here. Can you take off your shoes?
No, it's fine.
Thank you, though. Okay, and now I'm going to do your dorsalis pulse. And your tibial, just here. Okay, thank you. So I'm going to have you stand up again. I'm just going to look at your spine, okay? Okay. Thank you. I'm going to have you touch your knees for me. Spin that. Okay, so I'm going to inspect your spine. Great, thank you. You can stand back up. And if you can go as far back as possible. Great, thank you. Okay, so now I'm going to have you go from side to side. Okay, and I'm going to have you now, so inspect it. I'm going to have you bend, sorry, you're going to turn you around. I'm going to have you bend one more time. I'm just going to palpate your spine real quick. Thank you. Stand back up. I'm sorry. No, you're good. Okay, so I'm actually going to have you lift your leg up as far as you can. I'm going to have you lay on the table for me again. Thank you. Lay down for me. Thank you. Okay, so now I'm going to have you lift your leg up as high as you can. Thank you. I'm going to have you lift up the opposite leg as high as you can. Okay, thank you. Now I'm going to have you take out this leg as far as you can out towards me. Okay. Sorry. Okay. And then the opposite leg also. Okay. Thank you. Okay. Okay. And I'm going to have you now cross this leg over. Thank you. And then the opposite leg. Sorry. Okay. And now I'm going to have you lift this leg up and bring it as close to you as you can. Okay. And then I'm going to have you do the same thing with the opposite one. Great. Thank you. Okay. And now I'm just going to actually do this for you real quick, okay? So I'm going to extend this leg up. Thank you. I'm going to extend this leg up. I'm going to pull this leg towards me. sorry. That way. Put this one over. This one over. And then I'm gonna fold this leg real quick. Yeah, and then fold this leg. Okay, thank you, ma'am. Sorry. Okay, thank you, ma'am. Okay. So I'm gonna have you flex your knee one more time towards you, as far as you can, and then the opposite one, and then the opposite one. And you can extend it. Thank you. Okay, and I'm gonna do this for you again. Okay. Thank you. Okay, so now I'm gonna have you sit up for me. Thank you. Okay, and I'm going to have you. Okay, if you can go with your knees like this, and then go down, and then go inward, and then go outward. Thank you. And if you can just grip your toes, and then spread them for me. Thank you. So now I'm just going to do this for you. And if you can actually tell me, actually push it against my strength, okay? So I'm going to have you push up. Okay, push down. Push inward. Push outward. Okay. Thank you, ma'am. Okay. And, okay, great. Thank you, ma'am. Okay, so now I'm going to inspect your cranial nerves, okay? So if you can close your eyes for me, I'm going to put something underneath your nostril if you can let me know what the smell is, okay? Okay, if you can cover one nostril for me. Okay, if you can tell me what smell it is. Okay, if you can, huh? Yes, if you can cover the opposite nostril, and just tell me what smell this is. Yes. Thank you, ma'am. Okay, and I'm gonna have you, I think, write down for me. Great, thank you. Okay, and I'm going to have you, if you can wrinkle your face for me. Wrinkle your forehead for me. Thank you. And I'm gonna have you smile. You're gonna puff out your cheeks. And then I'm gonna have you raise up your eyebrows and stick out your tongue. Okay, great, thank you. And now I'm gonna whisper something here in each ear. If you can let me know what it is, okay? Taco. Sama. Great, thank you so much, ma'am. Okay, and I told you to cover the ear. Okay, so now I'm going to. Okay, great, thank you, ma'am. So, test reflexes. Okay, now I'm going to test your reflexes, okay? Do you know what? I got this. Okay. That's a good I forgot. So, I'm going to test your brachioradialis, which is right here. Here. And then I'm going to check your biceps. Just a little bit. Just relax your arm. Okay, thank you. And now I'm going to check your patellar reflex. So I'm going to here, which is hey. Okay, thank you. So now I'm going to do your Achilles. Okay, thank you. Okay, so now I'm going to do your plantar, which is basically I grab something like this. Okay, thank you. Okay, so now I'm going to vibrate this on each foot. If you can just let me know if you can feel it, okay? Yes. Yes. Okay. Thank you. Okay, so now I'm gonna touch your face with these, So this is going to be sharp, and this is going to be dull. This is going to be soft. If you can just let me know what they are, okay? If you can close your eyes for me. Soft. Sharp. Soft. Dull. Soft. Sharp. Dull. Okay, great. Thank you very much. Okay, and also your legs. Okay, thank you. Okay, so now I'm going to give you 2 items. So if you can just go like this, I'm going to put each item in your hand. If you can close your eyes and let me know what the item is, okay? Okay, what is in your right hand?
On top.
On top?
Okay. Okay.
Okay, thank you. And what is in your left arm?
A ring.
Yes. Great. Thank you. Okay. Okay, thank you. And now I'm gonna have you go like this, like you're flipping tortillas as fast as you can. Thank you. And if I can have you thumb to finger, or if I can have you go like this for me, as fast as you can. Great. Thank you. And then I'm gonna have you do the finger to nose. So I'm gonna have my finger, if you can go like this, and just follow my finger. Huh? Okay. Hold on. Sorry. So your arms are gonna be out. Thank you. If I can just have you touch your nose and then my finger. Great. And then the opposite hand. Thank you. Now if you can close your eyes for me. Do the same thing. Same thing. I'm gonna have you open your eyes, and if you can do the same thing, but I'm gonna be moving my hand, my finger. So you can do the same thing with your. Okay, great, thank you. Okay, great. So now I'm going to. Okay, so I'm gonna have you put your ankle and then pull it down your shin. Okay, on the other arm also. Okay, and then after you can go like this, act like you're jumping. Great, thank you. Okay, and now I'm gonna have you stand up and I'm gonna have you walk with me, okay? So if you can just walk a straight line here. Just normal, great. If you can come back and do that, but it's gonna be on your heels, please. Great. I'm gonna have you do that again, so on your tippy toes. Okay, and now it's gonna be on heel to toe, so heel to toe. Okay, thank you very much, friend. So now I'm gonna have you stand straight with your eyes closed for 30 seconds. And then your eyes open. Thank you. So now I'm gonna have you go like this. Palms up, and then your eyes closed. Okay, thank you very much, ma'am. So that concludes the physical examination. Thank you very much for your time and patience.
Thank you.